The majority of California's uninsured population is made up of undocumented immigrants, says the University of California, Berkeley Labor Center. So Governor Gavin Newsom has unveiled a budget proposal that would allow all income-eligible residents, regardless of immigration status, to join the state's healthcare program for low-income people, known as Medi-Cal. State budget analysts predict the plan would extend full-scope coverage to an estimated 700,000 people in California. For some California taxpayers, it is a reasonable step that will contribute to overall health. But others resent giving taxpayer-funded benefits to people who are not in the country legally. Human rights activist Lillian Serrano says she knows what it's like to live without health insurance.
I personally went through having to lose a family member because unfortunately, because of her status as undocumented, she didn't have access to preventative health care that could have probably saved her life.
Newsom says the plan is to ensure everyone in the state has health care.
Universal health care for all, regardless of pre-existing condition, regardless of the ability to pay, and regardless of your immigration status. We believe in this principle. We believe in the right to quality health care. We believe we are strengthened as a community.
Undocumented Californians under the age of 26 are already eligible to join Medi-Cal with full-scope coverage, and undocumented immigrants 50 and over will become eligible later this year. Allowing full coverage regardless of age and immigration status would cost the state an estimated $2 billion a year, according to state estimates.
In the pandemic, we saw specifically here in San Diego County, half of the deaths were attributed to migrants, to immigrants. And that was felt because for so long we haven't had access to medical care, including our undocumented community.
Reaction to the plan is mixed.
I'm not about, handing people free stuff for the rest of their life, but in this case, with so much death and sickness, it might not be such a bad idea.
People who didn't work in this country came illegal, so they violated the law of this country, and they will receive medical insurance and other perks. I don't think that it is right.
If I have to pay, especially being a healthcare worker, undocumented immigrants, they should have to pay too. They should go through the system the way, the legal, proper channels, get documented, and get insurance the way we have to.
I think it's a wonderful idea. I think a lot of undocumented people bring a lot of wonderful things to our culture and our community.
The budget is expected to take months to finalize. If the healthcare proposal is approved and signed into law, it is expected to take full effect in January 2024. For Angelina Bagdasaryan in Los Angeles, NRI's VOA News.